Good morning, Mr. Peters. I am Nurse Olivia, and I am here to discuss with you and your family about your condition. I understand your wife is here because you requested she is part of the teaching. Your wife has expressed concern about having lifestyle changes. Is there anything you know about strokes? Yes, you may lose some functions depending on the severity of your stroke. You did have some concerns over feeding. Mrs. Peters, your husband's now on parade diets because he has been cleared by the speech pathologist to be able to tolerate meals. Speech pathologists can determine by assessing how a person can tolerate swallowing food during their sessions and can teach ways to prevent choking. Your husband has had a mild attack from the stroke, hence why he was able to recover faster than most stroke victims. He was on PO for a few days, now that he is on parade diet. Now he is on the parade diet. His foods will have to be soft, and his fluids will need to be thickened to a certain consistency. If his foods are not at the right consistency, he would be at risk for choking. He will need to sit up straight and eat on his strong side of his mouth, where it is not as weak, and also avoid distractions while eating. Mr. Peters, if you have any difficulties to swallow, please contact our office and come in so we can evaluate and provide more teachings to improve the swallowing. Mrs. Peters, I know there's a lot of information. Can you recall what we just spoke about? I will provide brochures on what we spoke about the feeding. Mr. Peters is now on prescribed medications that will help with managing the stroke. He is on warfarin, which is what we call an anticoagulant. This medication helps prevent clots from forming. Mr. Peters, we will need to report if there's any bruising or bleeding, and if you feel unusually fatigued. Please call our office if you have any of these symptoms. We will need you to be tested 2 to 4 weeks to check how you are clotting and to adjust the dose per lab result. Ideally, your PT INR should be between 2 to 3. PT should be 1.1. I also see here you were prescribed atorvastatin. This medication slows the production of your bad cholesterol in your bloodstream, so you want to avoid grapefruit juice when taking this medication. Be sure to follow a low-fat cholesterol diet when taking this medication. You are also on lisinopril, which is another type of blood pressure medication. Take this medication the same time each day. If you forget to take the medication, take it as soon as you remember and record your blood pressure and pulse. Avoid double dosing. Is there any more questions you have for me today? I will send you both more of what we discussed so you can get more understanding of what was discussed today. Do not hesitate to reach out for any more questions. Thank you very much.